Hi, my name is Dr. Shawn Johnston. Today we're going to be talking about lumbar disc bulge and lumbar disc herniation. We're also going to speak about how they come about. How do we get these disc bulges and disc herniations? And also 2 good exercises to be able to keep us from getting one, or if you already have one, to help you not get another one and to support that back. Disc bulge and disc herniation. What is the difference between these 2 elements? A disc bulge is exactly what it sounds like. So you have in between 2 vertebrae a disc, a fluid-filled sac. And if that fluid-filled sac is damaged and it has a bulge, that bulge can then cause pain. 50% of the population have disc bulges and most of them are asymptomatic. But if you're experiencing symptoms, it is most of the time caused by that bulge, or that fluid-filled sac making contact with a nerve. Anytime you have contact with a nerve, you're going to have pain traveling down an area. If it's in the low back, it's going to be going down the leg. If you hit your funny bone, it goes into your fingers. So if that disc touches the nerve, you will have pain. The other option is a disc herniation. Sometimes that fluid-filled sac will leak after damage, or it'll explode after damage, causing the materials of that disc to come out and go into the low back. If this material touches a nerve, then it can give you nerve pain. But the main thing that happens with a disc herniation is the distance between the 2 vertebrae shrink. When you don't have that fluid-filled material maintaining that distance between the vertebrae and that closes down, then you are guaranteed to have nerve pain. The holes in which those nerves travel out, they are dependent upon those fluid-filled sacs to keep the distance away from them so that they got plenty of room. But if the disc is injured and herniated, then you will have a shortened distance and nerve pain. Lumbar disc bulges and disc herniations are caused most of the time by a functional deficit. Sometimes you're hit by a car or you have some type of accident or fall, and that disc will herniate or bulge through impact. But most of the time you'll hear people bending down to pick up something light as a feather and their back popping and going out. Well, why does this happen? People say, I've got a weak back. Why is it weak? Why do we get these disc bulges? One of the main reasons is what we do all day. We've talked about this in many of the videos before, but because we sit a lot, we have the tendency to have stiff hips and a stiff mid-back. If you have a stiff hip and a stiff mid-back, what has to move too much? What lies in between is the low back. That low back, we've all heard the word core. It should be strong and stable, but if it is having to move too much, if it's having to take on the role of what the mid-back and the hip should do, then you're going to get damage to that low back. Too much movement in the lumbar spine equals disc bulge, disc herniation, bone on bone, bone spurs, degeneration. All of these things will occur because of too much movement. The first exercise we're going to perform is the bird dog. As you can see, the patient is maintaining a flat low back and the hip is bringing up the leg. Also notice the mid-back, how it remains flat, and the arms come up through the scapula in the mid-back. There is no rotation at the low back. It maintains strong composure, and this helps to build core strength, hip mobility, and mid-back mobility. This final exercise is the glute bridge. Lying on your back and your hands lying flat, you lift up your pelvis. Watch to make sure that your hamstrings are loose by touching them, and make sure that your glutes are fired by touching the glutes, and then make sure your low back is loose by touching the low back. If you or someone you know is struggling with low back pain or disc pain coming from a disc bulge or a disc herniation, give us a call at 565-4200. That's 565 4200, and we at Relief Plus would love the opportunity to help you out. We are great at treating both of these ailments and would be honored to be able to help.